Right. Good morning. I'm Angela Weerasinghe, a postdoc researcher from Tajlat University of Sri Lanka. We are a group of scientists from Sri Lanka, USA, UK, and from Denmark working together more than a decade to find solution for pesticide suicides. In this particular study, we aim to design an effective interventions that might be reduce access to pesticides from shops for self-poisoning. As we aware, pesticide itself killing 150,000 people and another 3 billion people attempt suicide by injection of pesticides, especially in Asian countries. Um, Among them, around 20% of patients directly purchase pesticide from shops for self-poisoning. To best of our knowledge, the ZIPPER study tried to find an effective intervention to the issue. We followed UK's MRC guidelines, Medical Research Council guidelines, to develop complex public health interventions, and we conducted a series of studies in Sri Lanka. Our first study was qualitative, and that was followed by a case control study to identify risk factors that are associated uh, with high risk purchase. And that was followed by stakeholder analysis to find most promising interventions, and finally the pilot study to examine the most feasible or favored intervention. The first four studies actually design and develop potential interventions. And the last step was a step-based cluster randomized control trial that has been uh, is an ongoing study to test the effectiveness of the intervention. We found that very two clear risk factors buying pesticides from shops for self-poisoning, being intoxicated at the time of purchase uh, at very high out ratios, adjusted out ratio 36.5, and being an alpha again high out ratios 13.3. So these two risk factors, I mean, these are the high risk people actually we really want to avoid buying pesticides from shops. So based on these two risk factors, we could propose four potential interventions: farm ID cards, that is reduce, avoid non-farmers buying pesticides; prescriptions, which is similar to the medicine prescriptions; cooling offs; and gatekeeper training for pesticide vendors. And stakeholders preferred on gatekeeper training options. So we tested this approach in 14 shops in 3 months. At the end of 3 months follow-up, vendors reported that they have prevented 7 suicide attempts. So this is something like a promising interventions. Now, what we actually doing is testing this approach in a large scale, large step-based cluster randomized control trial now set up in 6 districts, which covers 3.81 million population. So the information gained from this RCT will directly talk about 40% of suicide. That is something like 60,000 deaths uh, every year. So if the intervention is effective, that might be saving many lives, especially in Asian countries. We kindly acknowledge the funding support from American Foundation for Suicide Prevention. Thank you.